Dr. Velu, now amidst all of this, testing is going to be very, very important as well. Remember, that was the mantra: test, track, and then you should begin the containment strategy to deal with, the second wave. Now, of course, that's going to be the case in third wave as well, ahead of third wave. So, how are we likely to tackle the issue of overcrowding that we saw during the second wave? The test results used to take about 4 to 5 days in some cases to come. So what is being done to deal with that?
I think if you really see from the testing perspective, we have enormously scaled up. So today, both private sector as well as the public sector has scaled up phenomenally when it comes to RT-PCR testing. Then now rapid antigen is actually acting like a rapid screening system across even rural areas. So I think we have a good start. Now recently ICMR has started approving some home testing kits too, where people can do self-testing. Though it is a very gross estimation just to really screen the people who have already got infected, their contacts and all that. For that, self-testing is used. But RT-PCR will continue to be the gold standard. But then we have to use right kind of testing, whether it is rapid antigen testing, self-testing at home, or RT-PCR, or even genome sequencing. All this has to be done. If we take if you start losing the momentum on testing, sometimes we'll be caught unaware, like what happened. So I don't think, independent of the fact whether the tests have come, the total cases have come down or not, we should not reduce now the cost of testing is also pretty low. Probably we are the lowest compared to anywhere in the world. So considering that, I think it's compared, now the self-testing kits are available for 250 rupees and other things are whatever 500, 700 rupees. So this kind of testing prices which is available in the market, we should not really reduce the number of tests being done across the country. On the top of it, I think we should also be keeping the COVID appropriate behavior, which is very important. And also we need to keep the campaign on, like television channels and all of them keep telling that people have to become responsible, not only in behavior but also in testing. Whenever you have some kind of symptoms, go and get tested immediately. Then quarantine yourself. If you are shy to go to a lab and test, then probably call the lab home to test, or you could even do some self-testing. So this kind of campaign should be going on to ensure that we don't take focus out of testing at any time. Vaccination, testing, COVID appropriate behavior, as I said earlier, all three go in hand. And in my opinion, we should not take our eye off the testing for any time soon, at least for next 1 year.
All right. Thank you very much, Dr. Velu.